for joining our conversations on social reproduction today. We are based at King's College London, and I'm Prabha Kotiswaran. I'm Professor of Law and Social Justice here at the Law School. And I'm joined by some of my colleagues today, Dr. Mathur Jana, Gail Andrew, and Jehosh Paul. So as some of you would know, the Laws of Social Reproduction project is an EU-supported project, which ended in July 2025. And we are now continuing to share some of the research coming out of the project over the coming months. So one of the key areas of research that we've been working on is the newly emergent unconditional cash transfers, which are being implemented in several states of the country. And this is a key area of our research. So as part of a multidisciplinary team of scholars, we have been studying the initial impacts of these cash transfers in several states. And our aim really is to adopt a feminist approach to these cash transfers in order to see how cash transfers can be made gender transformative. So in today's session, we will be sharing our insights from a policy brief that I have authored with my colleagues, Gail Andrew and Dr. Mathur Jana. It is called Valuing Care, Recognizing Rights, Reimagining Welfare, How to Make Unconditional Cash Transfers Gender Transformative. So this is available on our website, and you're very welcome to read it if you have to leave for some reason before we finish. Then in October, we will be sharing our research on another aspect of policy in India, which has become very popular now, which is fare free bus travel for women. In particular, we've conducted research in the state of Karnataka as part of our research on the state's 5 guarantee schemes. And so we will be sharing a report that we've written on fare free bus travel in Karnataka. And we think this has lessons for similar schemes in other parts of the country. And in December, we will share our research from the Tamil Nadu cash transfer scheme for women called the Urumai Thogai scheme. And we will keep you posted on the dates and links for those events in due course. So today I will be sharing some of our research, and I'm really, really delighted to welcome two distinguished researchers and scholars who have kindly agreed to comment on our work. So first we have Vibhor Mathur, who is a research associate at Cascade, and he's working on the evaluation of the Welsh government's basic income pilot for care leavers. And his doctoral research explored the effects of Work Free, which is a basic income plus pilot, on experiences of dignity, freedom, and decent work for the urban poor in South India. So welcome, Vibhor. And we are also absolutely delighted to welcome Professor Gita Sen, who needs no introduction. She's Professor Emeritus at the Indian Institute of Management in Bangalore. She's the former director of the Ramalingaswamy Center on Equity and Social Determinants of Health at the Public Health Foundation of India. And she is on the executive committee of the quite iconic organization DAWN. And her research areas are health and population, gender and development, and inequality. And she's played a key role in several international organizations shaping their agendas and policy briefs, including at the World Bank and the UN. So a very warm welcome to Professor Gita Sen as well. So what I will do now is really speak about some of the key insights of our policy brief on cash transfers. And for this, if you will just bear with me, I will very quickly share the presentation that I have for today. Give me just a second. Sorry, no, that's not what I meant to do. Okay, here we go. Right, can you see the presentation now? Wonderful. Okay, so great. So the key slide that I want to share with you is this one, which is really about cash transfers in India. This is the map. This is the takeaway from our event today, essentially showing how there's been a rapid rollout of unconditional cash transfers to women in India over the past 5 years. So it's not novel entirely because the state of Goa has had a cash transfer scheme for women, an unconditional one for several years now. But since 2020, we have a number of states which have been implementing unconditional cash transfers, typically as part of their state assembly elections. It's often preceding the state elections or after the elections have passed that they've delivered on their election promises to give money to women. So 11 states currently have issued unconditional cash transfers. We have 5 states which have promised unconditional cash transfers but are yet to roll them out. And we have the state of Bihar, which is currently in the news precisely also for the reason that one of the parties, the RJD, has promised an unconditional cash transfer to women. Now, what we find, of course, what's unique about these cash transfers is that they're unconditional. They're given to adult women, so in a very particular age group, and they're issued through direct bank transfers. Now, neither cash transfers are novel in the Indian context, nor are direct bank transfers. But what is unusual is the fact that these cash transfers are being given to adult women. They're unconditional and they use DBT. So this is essentially reaching 113 million women right now in the country, which is about 17% of the female population in the country. So this is quite a significant expansion of the country's welfare regime. Now, and of course, the debate around cash transfers, particularly universal basic income, is not new. So clearly, discussions of UBI started in India in 2017. They became a part of the 2019 general elections, and then there was an iteration of it, which assumed significance in 2024 in the form of the Mahalakshmi scheme. And in addition to that, there are several conditional cash transfers that are given to women, as well as to the elderly, to pensioners, and as part of the maternity benefit scheme. So these are not necessarily new, and they're also given to a lot of young girls who are either in secondary education or in higher secondary education or in university education. So the idea of conditional cash transfers is, again, not new in the Indian context. But unconditional cash transfers to women at this scale is something that is novel. So these first came up in 2021 in the state of Tamil Nadu. And many of the states which went to election that year spoke about unconditional cash transfers, or it was on the agenda of several political parties. So we find a scheme in Assam, we find a scheme in West Bengal, in Tamil Nadu, and there were discussions of these or promises in Puducherry and Kerala. Now, in 2022, Punjab and Himachal Pradesh followed. And in 2023, we have Karnataka, Chhattisgarh, Madhya Pradesh, and Telangana also making promises of unconditional cash transfers and beginning to implement them. Now, the point at which it really assumes critical mass is in 2024, where there's a string of electoral victories based on these cash transfers, supposedly, I would say, in the states of Maharashtra, Jharkhand, Odisha, Haryana, and Andhra Pradesh. To the extent that it is thought that the BJP, which was somewhat skeptical about these promises of cash transfers, insisted to the High Command that it be made part of the Delhi promises in the Delhi elections. And then, of course, we know that the BJP won in Delhi. Now, the popular debate around these cash transfers is very much still centered around the question of, are these freebies? Are they, incentives ahead of elections as exchange for women's votes? And so, of course, this is the general kind of discussion that's happened. And of course, there's also the sense that the beneficiaries of these cash transfers are also passive recipients of the money that's coming from the state. But what we want to do is to recenter a feminist analysis of these cash transfers. And the reason for this is that in other parts of the world where unconditional cash transfers were implemented, although the slogan was to use the cash transfers for women's empowerment, it did not actually play out that way because a gendered focus or a feminist analysis was missing when, in fact, these states implemented the cash transfers, and then when they were monitored and evaluated and scaled up and diffused by international organizations such as the World Bank. And so therefore, we think that at this point in India, it's very important for feminists to have a say in how these cash transfers are being implemented. So I just want to summarize quite quickly some of the debates that emerged in India when the cash transfers were promised in 2021. So one of the key, there's several arguments against the cash transfers, which I'll quickly summarize for your benefit. One is, of course, that in the Indian context, men appropriate women's money, so women won't benefit from the cash transfers. The second was that they can reinforce gender norms, especially the gender division of labor. Because if you remember, Kamal Hassan, when he promised these cash transfers, he called them salaries for housewives. And that was the point of departure for the discussion around these cash transfers. There was also worry from feminist economists that this might disincentivize women from pursuing education or seeking paid employment, that it did not actually address the lack of negotiating power for women in the workplace, that it could mean a reduction or an elimination of investment in public infrastructure, that it may be used to substitute for the existing welfare regime. And this is something you find echoes of in the debate on universal basic income. Then, of course, the point that it may not be fiscally sustainable in the long run. And finally, that it exemplifies what Yamini Iyer calls the techno-patrimonial welfarism of the state, whereby these cash transfers entrench personalized politics. Now, some of the feminist arguments for cash transfers, and this is something that has emerged over time. In 2021, there was less of a support for the cash transfers, but over time, as political parties have won elections, they have come up with their own reasons for supporting cash transfers. So one is that it promotes women's financial inclusion and financial literacy. It could enhance women's economic bargaining power. It can improve their emotional and mental well-being due to reduced economic stress. It could provide a safety net for those who don't have access to waged work or who are trapped in exploitative work. It could help women learn a skill. It could potentially recognize women's unpaid work and could set time boundaries on their work. It may help resisting intimate partner violence or possibly even exit abusive marriages. And it could improve women's empowerment, engagement in communities and amplify their political voice. Some of the additional arguments for cash transfers have been that it could coexist with investment in public services and infrastructure and social protection policies. It could further improve the bargaining power of scheme workers because often they are thought to be, performing an extension of unpaid work within the home. It could reduce malnutrition, reduce distress migration, help women engage in forest conservation. And because it is implemented through direct bank transfers, it could cut out intermediation and therefore promote autonomy. And finally, because the cash transfers came in the wake of the COVID pandemic, there was also a sense from politicians that it provided a demand-side stimulus to the economy, and this was often used as a justification for the cash transfers. Now, of course, there are many feminist priors to this discussion, not necessarily in the realm of cash transfers per se, but in terms of economic recognition for women's unpaid work. So, of course, we have the Wages for Housework campaign and its key insight. Now, there is debate within the campaign whether there should, in fact, be a wage or a care income, and there were splits within the campaign. But generally, the idea was that unless you had economic recognition of women's unpaid work, you could not put a price on it, and that therefore it would not be, that the surplus value that's generated on the backs of women's unpaid work would go unrecognized. And of course, Indian feminists have had a very long engagement with this question of economic recognition. Feminist nationalists argued for the economic recognition of unpaid work in the pre-independence and post-independence time frame. They talked about social insurance contributions by husbands for wives, for tax rebates for women's unpaid work. And interestingly, it's the state that's been most interested in talking about economic recognition. So in 2011, there was a proposal from the Ministry of Women and Child Development for women to have a stake in 50% of their husband's income. And more recently, based on some of our research within the project, we have looked at how Indian appellate courts have recognized women's unpaid work within the home as being on par with an occupation. And this has come about in the context, very specific context of motor vehicles accident cases where women died as a result of these accidents. And when men went to court asking for compensation for the work that women would have otherwise done within the home, the Indian courts actually departed from the typical common law principles around compensation for this work to essentially say that this is on par with an occupation. So we will fix a certain amount that could be payable on a monthly basis, and then we would have a multiplier effect for the rest of the woman's lifetime in order to then compensate the family of the woman. And the Supreme Court of India has, at least on 2 occasions, reiterated that this recognition of women's unpaid work is a constitutional obligation to ensure equality. So there are some parallel developments happening alongside the story of cash transfers in India. So in the policy brief itself, what we've tried to put together with the help of my colleagues, Gail and Madhushri, is to look at the amount that these states are offering to women. It could range anywhere from 830 rupees per month to 2,500 rupees per month. We've also looked at the budgetary allocation, which could range anywhere from 1% of the state's budget to about 7 or 8%. We've looked at the number of beneficiaries out of the total voter population, female voter population, and we find that these unconditional cash transfers go anywhere between 5 to 12% of the monthly household income in those states. Now, some states offer the cash transfers as explicit recognition of women's unpaid work. So this is the case in Tamil Nadu and in West Bengal and in Jharkhand, where there is a sense that women are performing this unpaid work, and this is in recognition explicitly of their work. Sometimes it's more implicit, and this goes back to why cash transfers are often given to women, which is that women will ensure that the money is used for the welfare of the household. So there's a certain sense in which there's an implicit recognition of the work that women do within the household to ensure the welfare of family members. So we find that the unit of dispensation also varies across these states. Sometimes the household is the basic unit, sometimes it's the individual. So more than one woman could receive it within the household. This is the case in West Bengal, for example. And sometimes it's on the basis of a nuclear family. So one nuclear family gets the cash transfer. And then there is a range of eligibility criteria and exclusion criteria, which we also document in the policy brief. These relate to age, but as I said, it's pretty much the period of adulthood, and it can go up to, it could go from 18/21 or 23 all the way to 60/65. And often residence is a requirement in the state, and the residence requirements can be quite onerous. So it could be anywhere up to 15 years of residence in the state. Some states require you to be either married, to have been married at some point, or be currently married. In other states, they prioritize single women. So, it's unclear, and they don't exactly map out according to political orientation either. And I'm happy to speak about that some more later. And often the exclusion criterion is based on the annual household income. So this could be anywhere from, 2 to 3 lakhs. So if you're earning more than that, then you're not eligible for the cash transfer. And then we have a category of socioeconomic privilege. And this is just a shorthand for saying if there is a government employee or a taxpayer or a political representative in the household, then the women in that household are ineligible for the cash transfer. And then we have one other point regarding availing of other schemes. So here again, there's a lot of variation. Some states restrict the household to one scheme, whereas some states ask if you're getting an equivalent amount from another scheme and then exclude you, or they give you the difference between what you would have gotten between an existing scheme that you're benefiting from and the cash transfer itself. So there is some variation here. And then we find that some states give priority to vulnerable communities. So in the selection itself, they would prioritize certain categories of women. And sometimes the amount is also differential. So in West Bengal, for example, there is a higher amount for SC/ST women rather than women from other categories. So, of course, given that these schemes are relatively new, there aren't many impact assessments, but there are lots of scholars working on these cash transfer schemes. And most of the studies have tended to be qualitative and smaller in size, but there are also larger studies which are in the works. So we try to summarize some of these um, lessons in our policy brief, and we've conducted also some of the sort of larger mixed methods studies in Karnataka and Tamil Nadu. So what we found on a very preliminary basis is that we're not finding that the cash transfers, and other scholars also seem to be saying this, that it does not disincentivize paid employment or education for women. It does not seem to be reinforcing the gender division of labor. And of course, this is debatable because it is already pretty entrenched, right? The gender division of labor. And the question is, we're also finding that women have complete control over the cash transfer. We are finding higher levels of financial inclusion and use of the financial infrastructure, as well as financial well-being and dignitary effects. And there is reduced daily household conflict. And by this, we mean sort of low-level bickering over money, because often women, since they don't have access to cash, often have to rely on men, and this produces some level of conflict within the household. So we find that there's a reduction in that kind of conflict. We have not seen any perceptible shift in the recognition or reduction or redistribution of unpaid work. And maybe this is too much to ask, but this is a question that we have asked very concertedly in all of our research. And when it comes to food consumption, intra-household bargaining power, and intimate partner violence, we've seen varied effects in the different states. And we're happy to discuss this further as well. And here are just some images, because obviously these cash transfers have been launched in what bureaucrats call mission mode in their states. And so there is a huge investment of state capacity in actually making these happen. And there's a way in which it also is reflected in the popular culture of these states. So on the left-hand top corner is an image of women in the state of Odisha. And here I just want to say that almost all the states give these payments on a monthly basis. Whether it's on a fixed date or not is debatable. But in Odisha, they give it twice a year. So the amount that the women get at that 6-monthly period is 5,000 rupees. And in this instance here, women have pooled together the money to clean up one of their neighboring rivers so that they could engage in aquaculture. And on the right-hand top corner is familiar to the Bengalis who are listening, is the Lokhi Bandar, Durga Puja Pandal, which is based on the contributions of women receiving Lokhi Bandar and who then shaped the Lokhi Bandar. So this is just some images. And then the key thing that we would like to propose that we have proposed in our policy brief is how to make unconditional cash transfers gender transformative. And for this, so there's a very long list of recommendations in the policy brief that I won't be able to go into entirely. But the first thing that we are focused on is adopting a gender-sensitive program design. For example, I'll just give a few examples. Avoiding eligibility criteria, which are in fact conditions, right? So in some states, when they've thought about cash transfers, they've thought about how women would only get it if they maintain the health status of children. So this becomes conditional while pretending to be an eligibility criterion. And some states require it to be based on the marital status, which we've also been arguing against. We also think that scheme workers should not be excluded from access to the scheme, because obviously when it comes to treating them as workers, the states don't treat them as workers, but as volunteers. But we believe that in this instance, they should be included within the scope of the scheme. Similarly, to make them trans-inclusive as well as inclusive of gender non-conforming minorities. So one is regarding the program design and eligibility criteria. The second is around implementation, again, in terms of registration, to avoid a political intermediation, requiring a certificate from the MP or the MLA, and also to reconsider onerous registration processes, which mandate documentation that can be very difficult to actually get. And here we also find that a lot of women are excluded from the schemes, either because they don't have a residential address like sex workers, or they're destitute, or they're homeless, or they're trans, or they're newly married women, or they're single, or they're deserted. So all of these women have difficulty providing the necessary documentation. And we are also keen to insist that women not be asked to sign self-declarations or affidavits, which literally list all the eligibility criteria of the scheme under force of penalty. So if it turns out to be that one of those conditions is not met, then women, action could be taken against them. So this displaces the onus of vetting the eligibility criteria onto the women rather than the state performing that crucial task. And we also believe that there should be adequate complaint mechanisms and processes of appeal so that women know why they're not receiving the cash transfer and whether they could appeal the decision of the state. We also believe that in terms of the use of UCT monies, although there can be messaging around how women can potentially use it, there should be no mandate on using part of it and keeping away part of it. The state shouldn't be making these decisions. It should be paid on the same day of every month, because we've found that women really anticipate the payment and plan their expenditures accordingly. And there should also be provisions to eliminate the recovery of unused monies in the accounts of the beneficiaries. Because although not many states require this, some do, but women are under the impression that if they don't use it, that it'll be taken back by the state. Also, we believe that there should be a long-term approach to achieving the goals of these cash transfers. So the cash transfer should have a very clear and specific rationale, which is communicated to beneficiaries. And we do think it should be used as an opportunity to focus on women's unpaid work and to make proactive efforts to improve women's financial literacy and access to financial infrastructure. And often we find that a lot of women don't have basic literacy skills. So, although they may be literate on paper, when it comes to actually engaging with some of these processes, we find that they actually are not able to, read what we would expect them to at that level of education. We also think that states have rushed headlong into the implementation of these cash transfers without collecting any baseline information. And economists believe that this is truly problematic then in terms of understanding the impact of these schemes. We also think that it's an occasion to for states to think about care more seriously, to think about care policies, to do more in terms of both reducing and redistributing the gender division of labor. So in effect, the cash transfers could be a vehicle for also thinking about unpaid work, also reducing unpaid work through various creative means and investing in the care economy, as many feminist economists have argued for over the years. We also believe that they should adopt a rights-based approach to care. So here we are talking about scheme workers, but also women in families. Because we've seen through a study of family law how women's unpaid work is not recognized at the point of divorce. And we think that it's time to also think about matrimonial property regimes. Finally, we want to embed welfare. We want to think about welfare from a rights perspective, which means embedding this right to economic recognition in law, alongside the Supreme Court's recognition of women's unpaid work, and also to use it as an occasion to conduct an audit of states' welfare regimes, and to ensure consultation with women as well as feminists and gender experts throughout the process, so that they're integral to discussions on whether these cash transfers are actually meeting women's needs, and of course, rigorous monitoring and evaluation studies. Last but not the least, I think we all know that cash transfers are not the solution to all of the problems that plague the Indian economy, and therefore the larger backdrop is something that we must always keep in mind, which is about providing women access to decent work. And often for women in rural areas, they want work close by where they live, as well as enforce laws against usurious and predatory lending practices of microfinance institutions in particular, to review the regulation of the alcohol industry, and to invest in health and education, because often this is the reason why women and households incur loans therefore the impact of the cash transfers is also needs to be considered in light of these burdens on the household. So I will stop there, and I now welcome Professor Gita Sen and Vibhor to offer their thoughts on the brief. Thank you.
Why don't we start with Vibhor?
That's wise. Get me out of the way before more sensible comments are made. Thank you, Prabha, for that wonderful presentation, and of course, more broadly, for sharing the findings from this very, very interesting policy brief. I'll give you quick context. My name is Vibhor. I work between the universities at Bath and Cardiff, as Prabha said, and predominantly my research is on exploring the effects of a universal basic income in different parts of the world. My doctoral research was focused on a UBI pilot we ran in the urban slum communities of Hyderabad with about 1,500 participants. Since then, I've worked on about 4 other major pilots, including currently evaluating the Welsh government's basic income pilot for care leavers. So a lot of what I'm sort of going to say is reflecting on the research from my work in Hyderabad, in the slums there, and trying to relate that to the wider trend that we are seeing in the last few years, which Prabha contextualized so wonderfully, as well as link it to a little bit to some of the theoretical claims that have been made around unconditional cash for a long time, particularly from a gendered perspective. Just sort of a quick piece of context, to add to what Prabha has already said. At this point, the amount of money that is being allocated to unconditional cash in India from the government across several subnational government levels equals nearly 11% of all of the social sector spending that is being done in the country. This means about roughly 2.8 lakh crores is being put in unconditionally into the hands of people from governments. Prabha mentioned that this was a key part of the policy discussion in the Economic Survey of India in 2017. But obviously, prior to that, there was a massive UNICEF-funded pilot run by SEVA in 2011 and 12 in Madhya Pradesh, which was obviously very influential. And I think in some ways that pilot is really important to remember, not least because it was the first of its kind in India, but also because of what was happening at the time, which I think is reflective of some of the debate that's going on currently. At the time, we were seeing this tension between the sort of the unconditional cash camp that Guy Standing and Rana Jadwala were promoting, and the right to food camp that was a major policy campaign at the time, led by multiple other thinkers. And in some ways, this has been an indicative tension in policy reform across the world. This mythical debate that's created between universal basic services and universal basic income, a fiction that I think we should not buy into necessarily because it inherently weakens our imagination around policy reform. But this debate has been extremely, extremely powerful. Across the world, people have said that cash is bad, predominantly because it weakens claims of citizenship and it weakens government incentive to invest in other public services. Yamini Iyer, as Prabha said, has written about this very strongly. And there's 2 sort of big concerns there. The first is around the claims of weakening citizenship, the fact that citizen-state relations end up going from one of active citizenship, where the citizen demands something of the state, to one of patronage, where the state is giving something to the state. And I think this needs to be contextualized in 2 different ways in my mind. On the one hand, there's the question of what is to be, from my perspective, lauded or appreciated about what's happening currently. The shift to unconditionality in many ways represents, hopefully, in an ideal world, a sort of philosophical paradigmatic shift of how we think of welfare. And in my multiple conversations with policymakers across the country, they've said that the big difference to their mind is that unconditionality, as compared to all the other forms of welfare that have happened in India, is a step towards trust, or operating from a position of trust, as opposed to from a position of mistrust and scarcity, which is where targeting, conditionality, and all of these things come in from. And in many ways, that is something that's quite positive to think about, the fact that the state is creating relationships of trust with its citizens, transferring that trust. And in many ways, these philosophical values in the construction of the design of the schemes and in the communication of these schemes are truly powerful when it comes to concepts around dignity and empowerment. To give you a couple of insights from my research in the slums of Hyderabad, multiple participants, and many of them women, would tell us that the beauty of receiving unconditional cash from a dignity perspective is what they described as feeling doubly seen. And I really, really like this phrase. They say, on the one hand, receiving cash feels like somebody recognizes the fact that they have needs. Somebody recognizes the fact that they've been left behind by the system, despite the multiple schemes that may exist. But the fact that it comes unconditionally makes them feel that they're trusted, which is a very rare experience for the poor in India. Rarely is policy transferred to them from a position of trust. And I believe that in the design of the scheme and in the communication of the scheme is a truly important exercise. And this element around communication, I think, is critical. I think the packaging of unconditional cash is something that isn't receiving enough attention at this moment anywhere in the world. So those on the left and those on the right are simultaneously making claims for greater unconditionality in cash transfers. The right really likes it because the likes of Elon Musk think that delivering an unconditional cash to people means that we can minimize governance, minimize government, trim the fat around bureaucracy, the dog movement, etc. And those on the left think of unconditionality, perhaps in the way that I was describing it, in a way of it's a transfer of trust, it's a transfer of autonomy, it's a transfer of dignity. But to my mind, unconditionality in and of itself is value neutral. Unconditionality doesn't in and of itself come with value judgments attached to it. It is the packaging around that unconditionality. It is why this money is being delivered unconditionally and what is the accompanying policy ecosystem of support that accompanies the cash. That's really, really important when it comes to questions around empowerment, questions around dignity. Elon Musk's UBI will also be unconditional, but it may or may not be accompanied with the transfer of trust, with the transfer of dignity that is so important to what we are trying to achieve in this process. The second thing that I think is worth lauding is in many of the states where unconditional cash is being given, Telangana, Tamil Nadu, and Bengal that I can speak of from personal experience, there is some very, very sophisticated advancements in the technological back-end infrastructure that are enabling the targeting and transfer of this money. Till a few years ago, there's the famous Montek Singh Ahluwalia quote, if it costs 3 rupees to deliver 1 rupee of welfare. This is obviously pre the DBT era. But to go from that situation barely 20 years ago to a situation where money goes from the Ministry of Agriculture's RBI account directly to a farmer's bank account in Telangana is quite impressive. And the fact that they've managed to layer the Dharani land access database, the rice growing database, and the Aadhaar database, etc., to find this sort of identification is very, very important. Of course, this does not take away from the fact that there's the creation of new digital invisibilities. As some estimations say, there's almost 10 crore individuals who don't have Aadhaar cards. And as Prabha was rightly saying, these end up mostly being religious minorities, trans people, street dwellers, and those with pre-existing vulnerabilities and multiple other disadvantages when it comes to ascriptive identities. So there is cause for celebration, but also cause for worry, because from an administrative burden perspective, and I hark back to this brilliant job market paper by Sarika Gupta from about 10 years ago, which was studying the pension scheme in Delhi. And pensions, much like cash transfers, are pitched as this simple intervention, an intervention which minimizes the number of transactions that are needed to deliver a benefit to the citizens. Still found that a scheme like that takes about 10 transactions for a citizen from when they hear about a scheme to when they receive their benefit. And the rough cost of any transaction is about 500 rupees, whether this is in lost wages, whether this is in transportation cost, whether this is in some sort of bribe. So it roughly costs about 5,000 rupees, not very long ago in a DBT era, for a citizen to engage with a simple transaction. My work in Wales with the policy team that ran one of the world's most ambitious basic income schemes. And within basic income literature, there's long been this argument that we can minimize bureaucracy. It's a simple intervention. But actually what we're finding is that the role of bureaucracy continues to remain important. It just transforms. And I think that's really, really important to sort of go back where I started, which is this debate between basic income and basic services, to my mind, is fundamentally facetious. Because at the end of the day, the argument for both comes from a place that recognizes that market systems are incapable of correcting the distortions of inequality, and the state must come in. In the UBI world, there's a call for UBI plus, which is give people cash and give them support. To my mind, that argument is always plus UBI, which is what is the UBI being added on to? Because in the UBI pilot that we ran, the top 3 areas of consumption were household expenditure, education, healthcare. Systematic reviews across over 110 pilots have found that across the world, these 3 remain the top areas: education, health, including, believe it or not, in developed countries like the US, which should have a healthcare system but don't, but that's a whole separate debate. And therefore, it really shows that cash, even there, is plugging in the loopholes of where the welfare system should come in, but isn't. And I think that's a really important, sobering finding, even for the staunchest advocates of a basic income, that a cash transfer is really, really powerful, because in cash-based economies, cash remains the most versatile and powerful tool of empowering people to meet their varied needs. Having said that, cash alone isn't enough, and this was one of Prabha's main sort of recommendations and conclusions. The advantage of cash is that no matter who you are, whenever you fall through the cracks of a system, as a universal medium of exchange, cash can empower you with the abilities to meet your needs. That does not mean that if I live in a tribal belt of Assam, even if I have 5,000 rupees in my bank account, but the nearest hospital is 50 kilometers away, it's not solving the problem. The sort of last thing that I will say, particularly from a gendered lens, is within UBI literature, there's been a lot of enthusiasm around what universalism can do to advance the gendered goals of socio-economic reform. That is, mainstream market and government interventions are built around a classic worker-earner trope, which fundamentally prioritizes or imagines masculine, if not male, recipients. And universalism will recognize the varied life experiences, needs, responsibilities, and priorities of people. But universalism will always have the problem of glossing over inequalities. And from a gendered lens in particular, and I'm trying to sort of take this beyond just women, but from a gendered lens, universalism is not the solution, even if though it's a step in the right direction, because universalism has the problem sometimes of glossing over specific needs, of recognizing the unique vulnerabilities of those recipients. And Nancy Fraser has this brilliant framework around what makes a policy gender transformative. And from a basic income lens, one of the core questions that she asks is, what is changing in the lives of those people? What is changing in the economic system of those who are receiving this money before the money comes in? Because the money in and of itself is not gender transformative. It is the conditions that the money can enable. And again, there is some cause for enthusiasm. Within my work in the slums of Hyderabad, women said some really empowering things from a gendered perspective. One woman described the unconditional individual cash that she was getting as transparent money, which I think is a really interesting finding, because she says the income that we earn, these are garbage collector and domestic worker households, and she says the income that we earn comes to my husband, and I never fully know how much we've earned in a month. The wages change, sometimes the expenses change. This is transparent money. I know exactly how much is coming. I know what is coming in my name, and I know I can save for the next 5 months to buy the cupboard that I need to buy to put my clothes in. There's this wonderful story from the 2011 Madhya Pradesh pilot where a 14-year-old girl has written a letter to her grandmother saying, I know there's money coming in my account. Please, can you put it aside? I want to buy a bag when I come back home. And there's elements of citizenship that are truly gender transformative. Across the world, we see an increase in asset ownership, which are, feminist economists have long claimed are gender transformative assets, things like mixer grinders, fridges, washing machines, things that reduce gendered responsibilities. And therefore, one must remember that cash does have power to be gender transformative, but it is one within a sort of gamut and a bouquet of transformations that is required to achieve the goals that we want. Probably spoken for longer than I needed to. I'll stop there and pass on to Professor Sen. Thank you. I think you're on mute. You're still on mute.
Yeah.
Thanks very much, Vibhor. I'm glad you went before me. because there's a bunch of things you said which I now don't have to say. And you said them extremely well. Let me start out, Prabha, just by congratulating you and your whole team. This is work that you've been doing consistently and with a great deal of depth for some time. And I'm delighted to be, I should have sort of read it more carefully before, but you know what our lives are like. But I'm glad I've had the opportunity to look at some of it, and I think it's truly terrific. I just remember, since I'm probably one of the few persons in this group, maybe the only one, who was alive and working as a feminist academic at the time when wages for housework happened. I am really pleased to see this, when I think about the discussions we had when the Mexican CCTs, conditional cash transfers, happened, the Progresa Oportunidades program, and Molina's work and that of others on critiquing the conditionalities and what that might mean from through a gendered lens. Compared to that, we've come a long, long way. I also remember when the Benazir Bhutto scheme came on, it was like this, oh, really? They're letting them just give them money? That's amazing. And I still feel sometimes if I were to go to sleep on this, I would have to pinch myself when I woke up to say it's still happening. They haven't taken it away yet. And I'll come back to that question at the end of my 5 minutes or so of comments. So having said that, let me also say one other thing. I'm really looking forward both to hearing about the Tamil Nadu case, but even more so the Karnataka case, because we went to those elections with our fingers crossed that these 5 guarantees were going to do the trick for us. And of course they did, among other things. So the first and most interesting thing I think about the work that you're doing is that cash transfers, whether conditional or unconditional, have traditionally been seen as either poverty alleviation, in some cases, perhaps rarely, as demand-side stimulus from a macro perspective, and of course, castigated as pre-election freebies, promises, blah, 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 etc. Care work has been rarely acknowledged. And the fact that these might actually be payment for care work. And I think your work, Prabha, brings out very nicely sort of the legal and policy ecosystem in India, including these Supreme Court judgments that you pointed to, which have turned unpaid care into, at least nominally, the equivalent of a job or work, the recognition as work. And I think, therefore, India may perhaps have been the perfect place for the experimentation on such a scale. Let me just say as well, and then put it aside, that India is also important because, as you said, it's 11 states plus another 4 or 5 give 1 or 2 minus plus. The possibility of looking at variability and being able to much more fine-tune under what conditions, what works, what doesn't, why, etc. And I think that that's a big obvious next stages of your work that would be really important to develop. As you said, care work has actually been explicitly acknowledged in Tamil Nadu, Jharkhand, and West Bengal. And of course, Tamil Nadu is the front runner in all of this, as you said. I think some of the questions, however, that feminists have raised don't go away. Let me say, first of all, that I am not among those who believes that you give money today and somehow the gender system will transform itself by tomorrow. It's not going to do anything of the kind. It's going to be quite a while before we see this and sort of work its ways through the gender system in order to change the ways in which women can address and tackle the challenges of the gender oppressions and the extent to which that might actually mean a change in the lives of young girls who are just coming into it, coming into the system today. So I don't believe it's going to, it would happen overnight. It's certainly something. However, and some people, even on the question of violence, some people have raised the question, does it actually reduce or increase violence? I mean, does the fact that there's money coming into the woman's hands make her more a target of violence or less? And because it isn't cash, because it's going into her bank account, I think that's a big factor in saying that it's not so easy to hit her over the head and take the money away from her and go and spend it in the local bar. But we don't know. Those are all things that I think we need to look at. The question of the extent to which it actually redistributes or socializes care work still remains, I think, open. We need to know what it's doing to that. And I think you're right in critiquing that Indian thing between universal basic services and universal basic income. I think it was too simplistic a rendering of the difference, but the difference is real. I mean, what does it do, or does it do anything to the way in which care itself is handled in the economy and society? And as Vibhor pointed out, it's not a small amount of money that we're talking about here. But it's a small amount of money, it's a significant amount of money distributed very widely. And that's a big difference. It's not going into a few pockets carefully. That's one thing that we need to look at. Second one, what does it do to women's productivity and their ability to work? Do we find, I mean, what is it that's happening there between the care, unpaid care, paid care, and what's going on with that? And do we see any forms of attempts to socialize care beyond the grandmother and the grandparents in the house and whoever else looking after young children? The third question is, does it have any impact on care itself? Because care at this point, and in India, your map was fascinating, because it almost would be completely congruent with the states in India that are aging, where the total fertility rate has gone below replacement and aging is a serious issue. So the care economy in India that we're talking about is not just of children, it's of older people. And the system is far less geared in every way, legally, institutionally, even market-wise, to handle that than it is otherwise. And what kind of changes need to come in the institutions of care that would then make this be the complement to this payment. You know, it would be really interesting to do a comparison to the minimum wage. How much is this relative to the minimum wage? Now, if we were to look at the average minimum wage in India, which is somewhere, you know, all things put together under 200 rupees, this is probably somewhere around that range. Central government minimum wage for unskilled workers is, I think, nearer 800 rupees, almost 4 times that amount, which would be considerably above whatever amount is being given by way of these transfers in most places. So in terms of next generation legal challenges, that would be a good place, I think, to bring before the courts to say, so what is it that, yes, you say that women need to be paid for this. So what is it that you're suggesting they be paid? And how much is it relative to, you know, the larger labor market? And my last question is this. What is given can also be taken away. And we live in a world of austerity and inequality. So what is given to him that hath is never taken away. It's never even accounted. But what is given to the have-nots, every penny, every paisa of it is counted and accounted for. And somewhere, I mean, already in the Karnataka elections and thereafter, in the internal struggles within, for instance, the BJP, about should they be for it or should they be against it? And of course, there was a huge groundswell of clamor from the ground, from their people saying, no, please, we need these in order to win the elections. But one of the arguments being made is Karnataka is going bankrupt with this. Cannot be done. Everybody is just giving away money, and it's going to mean huge burdens and austerity for states and for the center. And given the larger, and this is India, which is relatively insulated by its size and the size of its economy from the pressures of the IMF or the World Bank, relatively speaking. But the pressures in a world of a huge debt overhang and austerity as more the rule than the aberration, can we be sure? And in which ways, let me put it differently, not can we be sure, in which ways can we build the case for and insulate these payments as being extremely important for both rights, but also for the economy? Because the latter is the one, as we know, that has selling power, much as we may like the former one. So let me stop with that and hand it back to you.
Thank you so much, Professor Sen, and to Vibhor. Those were all just
Call me Gita, please.
Gita. Okay, Gita and Vibhor. Thank you so much for these really, 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 really thoughtful comments. I think it contextualizes, the debates in which we're operating and who our interlocutors are, but also asks very important questions about, the present and the future. So, I mean, I don't necessarily want to respond to all the comments, but maybe I'll just pick a few. I think, Gita, your point, I'll start with the last question because it's the most resonant in some ways. I think in terms of the economy, I think in Karnataka, the fiscal pressures are very deeply being felt currently within the government. And so despite the public sort of tenor of celebrating the guarantees, so to speak, it's anyone's guess how long they can sustain these guarantees. And I think in that respect, our own sense is that maybe it makes sense to give less, but give more frequently. Because very interestingly, given the beast that patriarchy is, when you promise a certain amount and then don't give it, there's an initial phase where women are very happy they're getting the money, so we did some work 6 months into the scheme being rolled out, and women were getting it frequently. It made a big difference, right? All the dignitary effects, all the ability to not stretch your hand out to the husband to, run the household. But when we went back at the 15-month mark, we were finding that there were delays. And that had already shifted the bargaining power between the husbands. So the husbands were saying, and because of the size of the transfer, it sounded as though the men had said, well, why don't you just take care of the household, is what they had been saying. And when the money wasn't coming, the women ended up borrowing from various people, including their husband, with the expectation that they would be, paid back. So it's very fascinating, I think, which is why looking at this very qualitatively, really understanding what it's doing to these patriarchal relations is very important. So I think that could be the reason to both say that, we have to think about the economy. So maybe to reduce this so-called backlash that is building up, maybe you give less of it more frequently. That's one way of just program design and being realistic about it. The other is to simply embed this in a right to care law, which is what we are very keen to kind of propose, which is to say, now what exactly does that mean? But I think there is a lot happening in the Latin American context that we can draw on to think about this. I think on the question of minimum wages, I think that's a classic sort of question of how do you quantify women's unpaid work, right? It's something that we've never really been able to fully answer. So I won't try, but I think thank you, very perceptive thoughts on how the aging question, the reduced fertilities, has to help us reimagine welfare and the level of care work and investments in the care economy. And yeah, I mean, there are a few other things that I could talk about. I mean, in terms of violence, we see some differences between Karnataka and Tamil Nadu. There is some hint of a backlash in Tamil Nadu that although the numbers of women who might experience it is very low, there is some sense that there might be slightly more violence. But in Karnataka, we didn't really find that. Because of the size of the transfer in Karnataka, much higher food consumption in sort of high nutrition kind of, items. And I think I completely agree with you in terms of socializing care work. I think one of the peculiarities also in the Indian context is, social identity and things around the caste system, which it seems like socializing certain forms of care are very problematic. So it is something that we need to think about how you might socialize it appropriately, or provide, ways of reducing this work at a household level. And I completely agree with you. All the important feminist questions don't go away, but I think we need to pose them and somehow bring them into the mainstream of the discussions with the government. It's a ripe political opportunity to bring some of these questions back in and keep them constantly thinking about it. For example, the Griha Lakshmi scheme, there's no sense women are confused why they're getting the money. I think it's a missed opportunity to not, as Vibhor said very rightly, the communication is very, very important, not just unconditionality, but what could be done with it. And women themselves are also very creative about what they could do with the money. And I completely agree with you, Vibhor, on the transformation of the bureaucracy and completely this false debate between UBS and UBI. And I think Karnataka is a particularly good state to think about UBS and UBI, although Tamil Nadu has many of the basic services, including an electricity subsidy and free bus travel for women. So it is something that, and I completely agree with you on everything else that you said around the infrastructure is a huge jump, while also producing some forms of vulnerability. And we really do think that, and I also think the cultures of citizenship vary across the country. So I think in the southern states, we've actually found women asserting their right to receive these amounts, as a form of their simply being citizens. So we would often ask, what would you like? Would you like the transfer or would you like jobs? And they refuse to actually, and there are differences between Tamil Nadu and Karnataka on this, but women often said we would like both, actually. And and we have a right to this. So I think, so it could be that maybe in the North, cultures of citizenship are somewhat different. I'm not sure, but there is a lot here to clearly think about. So thank you for really this very productive conversation. I just want to invite some of our colleagues who are listening in, whether they had any thoughts or reflections. Yes, Shimanti, go ahead.
Okay. Yeah, Prabha, thank you so much for this. I have one observation and one question. I'm not very familiar with this scheme, but I am actually somewhat familiar with the Lokhi Bhandar in West Bengal. So one observation is that the sex workers in Sonagachi, actually, I had a very preliminary conversation with them because they were saying, why would we go for the Lokhi Bhandar? What happens to the dignity of our labor, right? That's something, I mean, that was interesting. And that's something, you and I kind of, I mean, because they were like, no, but we want that we work, we are workers. So why would we want the Lokhi Bhandar, right? But the question that I actually have in terms of gender transformation, and this is again very limited to to West Bengal, I'm kind of wondering, like, the gender transformation in terms of respectability politics in Bengal, especially like the Bhadralok politics, like again, I mean, I'm not really researched this, but a lot of the Bhadra Mohilas, like the women, there is a very significant class element to that. Because the women of the Bhadralok class, the Bhadra Mohilas, think that this is like somebody who is of the lower class, right? Why would we do that? There is this idea of like respectability, right? Because, my husband earns enough and I am good here. This is my job. I'm a mother and I care. So there is almost a resistance to being paid for care work. So I'm kind of wondering in this context, how may we think of this as gender transformative when class and respectability politics kind of intervene? Like, how are you kind of conceptualizing a larger national and state narrative and a discourse when this kind of the class element and the respectability politics kind of gets into the way of gender transformation policies?
That's an excellent question, Shrimati. Thank you very much. I think I do remember, I think I think West Bengal is unique in the sense that it's really almost universal, right? Other than government employees, you're asked, you can have 2-3 women in a household getting Lokhi Bhandar. And because the eligibility was tied to getting the Swasthya Sathi card, the health card, which is actually quite lucrative, I think it's beneficial also for middle class families. So I do remember at one of the big Dware Sarkar camps where, the men were trying to convince the middle class women to also register for Lakhi Bhandar. They came there for Swasthya Sathi, but, also saying, why don't you apply for this? So I think, yeah, I mean, it is something that we have to work through. But I think West Bengal might be unique also in that sense, because it's not quite as universal in the rest of the country, right? Because it is means tested. But I think in terms of recognition, and conversely, when you ask poor women, do you think this is being given to you? Or rather in Tamil Nadu, we said, well, this is, you do know the notification talks about this being in recognition of unpaid work. The idea of care work is being personal work. And there are, they use the full range of terms to share that, which is that this is personal work. Why would why should anyone pay for the? So I think you're right, whether it's rich or poor, the question of care work, like you come across different barriers to trying to think about how this can be gender transformative. But one thing is also very interesting, irrespective of whether you're wealthy or not. So a lot of the poorer women in both states, about a third of the women we spoke to said, when we asked them, should you rethink the eligibility criteria for the cash transfer? They said actually all women should get it. So 30% of our cohort in both states said all women should get it. And the reasoning precisely was that wealthy women do not have access to the household income. So they feel bad when they look at us and they are not able to use they don't have control over their ATM card. They see that we get our own money, which they are not able to get. So it's a very fascinating flip. And there is a sense in which I think all women recognize that marriage is a transaction. Underlying the question of this being personal work is also the very clearly felt understanding that, he married me and the bargain is that I do the unpaid work in exchange for being maintained. So I may be lucky every now and then, almost like an employee. I may get a tip, I may get like a gift every now and then, but really this is the deal. The deal is that I get paid. He takes care of me for the unpaid work that I do. So we have a long way to go, I think. But the women understand this. I think that's the interesting part. So I think the assumption is not that they're passive or like they theorize their condition in so extraordinary ways. So I think it's something to build upon if we can manage. Great. Any other questions or any other reflections, Vibhor and Gita? Would you like to say anything? Okay.
I think I would just reinforce, I think, Simanti's question. I think that's absolutely fascinating. I'm not Bengali, I'm married to one, so I know the culture and the community through that. But I think this business of the politics of respectability would be a nice side project for this one, and how it gets in the way of the recognition of care as work. Class, caste, and the politics of respectability, and how that might vary in across the country in different places. Because I'm trying to think whether in Tamil Nadu or in Karnataka there'd be a similar response. I'm completely off the top of my head based on nothing at all. I don't think so. I just, I'm trying to imagine it. I can imagine it very well in Bengal. I can't imagine it in Karnataka or in Tamil Nadu. But as I said, that's completely based on nothing except hot air. And by the way, one thing you might want to look at, Prabha, is among the states that haven't done this, interestingly, is Kerala. And that could be either because Kerala provides a lot of other things directly through the public system, but it could also be because of the fiscal crisis of the state. And so that question of, I think that fiscal question should be addressed. And it should be addressed relative as well, as I said, to what else is this, who else is the state giving away money to? And what else? In order to insulate this from being the one that somehow, ruining women, spending away the money of the state, etc., etc. I think there is a real risk there, and it would be good to have somebody looking into that.
Thank you, Gita. That's very valuable. Yeah, Vibhor, you want to respond?
Just one quick thought, which is really coming to me from, what Simanti picked up, what you were saying, Prabha, about how participants are sort of framing their deservingness, and going back to what I was saying about the constructions of deservingness in the communication around unconditional cash. I think there's a ripe side research project almost to look at the political negotiation between citizen and state. If these are the perceptions of deservingness, if these are the claims to respectability, to deservingness that citizens are making, then I think we need to start, going back to Yamini Ayer's worry around citizenship, we need to look at what these political contestations are. Is this contestation of what one deserves and what role cash plays in this part of the political tension that is happening? And how does this play into deservingness perceptions from citizens, from states, and what is that tension? Because in a place like Bihar, one can say that the RJD is making, well, I won't go into those facts. The calculations of paying 2,500 exceed Bihar's entire current budget. So I won't go into that. But what is that political contestation? What is happening in those claims that people are making, if these are their perceptions of deservingness? If unconditional cash is becoming increasingly mainstream, what is happening in Maharashtra when the Ladli Behna payments are stopping, or however many 100,000 people are being taken off the rosters every month? And I think that links to the question what Professor Sen was saying about fiscal sustainability, because there's the study of where this money is coming from and where this money is. Because in places like Karnataka, this money is being pulled out of some places, and in places like Telangana, this money is being taken from greater debt in already debt-ridden states. And I think that has implications for not just the fiscal sustainability, but the wider vision of welfare reform within which unconditional cash fits. So I think that two-part political contestation of unconditional cash, I think it's slightly simplistic now to say it's just a poll promise, because we've seen it sustain beyond polling cycles in enough states to now start thinking how this feeds into our political contestations, into imaginations of citizenship, and into both the claims citizens are making and how policymakers who are championing this are visioning this reform.
Wonderful. I think that's really valuable. I think just very quickly on what Gita mentioned about Kerala. So in 2021, they were also caught up in this scheme, trying to promise pensions, if I remember right. As they had kept it very vague, and I think precisely because of the fiscal crisis, they never went back to it. They, the efforts to reduce women's unpaid work through the Smart Kitchen scheme and then the Easy Kitchen scheme never really, it just petered out effectively. It seems like the fiscal pressures were really on top of their mind. But I think it's an excellent idea to look at why certain states are not giving it. And for example, in Bihar, why the BJP will go rather to SHGs and, giving money for livelihoods rather than something else. So I think definitely. So I think we are well past our time, and I'm really grateful for your really wonderful engagement. And I just want to say that we will have both this session on Tamil Nadu in December, as well as hopefully Karnataka in January. So we will be able to explore some of these questions around the cultures of welfare and certainly citizenship further in future sessions. So thank you so much. Thank you all for being here today.